6 silent signs an elderly loved one may be in their last year. Have you noticed unsettling changes in your elderly loved one? Subtle shifts that feel different from normal aging? Maybe they're sleeping more, withdrawing from conversations, or just seem distant. Many assume the end of life comes suddenly, but the truth is, the body often whispers its warnings months, sometimes even a year in advance. The heartbreaking reality? These warnings are easy to dismiss until it's too late. But recognizing these silent signs early can change everything. It allows you to offer the best care, create precious moments, and ensure your loved one's final days are filled with warmth, dignity, and love. In this video, we're uncovering 6 overlooked but crucial signs that may indicate an elderly loved one is in their final year. These aren't just typical signs of aging. They're red flags that many miss. Stay with us until the end, because understanding these warnings now can help you provide comfort when it matters most. 1. A sudden change in sleep patterns. One of the earliest and most subtle indicators that the body is transitioning is a drastic change in sleep habits. If your loved one starts sleeping significantly more during the day or struggles to rest at night, it could be their body's way of conserving energy. While many associate excessive sleep with boredom or lack of stimulation, in the elderly, it often signals the body's attempt to slow down and preserve its remaining strength. The circadian rhythm, which regulates our sleep-wake cycle, can become disrupted as bodily functions decline. This may result in frequent daytime naps and increased difficulty staying asleep at night. Some elderly individuals may even experience fragmented sleep, waking up multiple times throughout the night for no apparent reason. Others may report having vivid dreams or hallucinations, which can be alarming, but are often a natural part of the body preparing for its final phase. Additionally, changes in sleep patterns may be accompanied by a shift in behavior. If your loved one begins dozing off during conversations, struggling to stay awake during meals, or appearing disoriented upon waking, it could indicate more than just fatigue. It could be a sign of the body gradually shutting down. Monitoring these changes can help you provide the necessary comfort, ensuring they get adequate rest while remaining as active and engaged as possible during their waking hours. Understanding these sleep disruptions allows family members to adjust caregiving approaches, such as modifying daily routines, creating a soothing nighttime environment, and ensuring their loved one feels comfortable and secure. Rather than dismissing excessive sleep as laziness, recognizing it as a silent warning sign can help in making informed decisions about care and emotional support during this critical time. Loss of interest in favorite activities. Has your elderly loved one suddenly stopped engaging in the hobbies and social activities they once enjoyed? A noticeable withdrawal from beloved pastimes, such as gardening, knitting, or even watching their favorite TV shows, can be more than just a passing mood change. While it may seem like a sign of boredom or fatigue, this shift often signals something deeper, the body gradually redirecting its limited energy toward essential functions. As the body's internal systems slow down, even the simplest activities can become overwhelming. A person who once eagerly participated in family game nights or looked forward to morning walks might now seem uninterested or even reluctant to join in. This isn't merely a lack of enthusiasm. It's often the body's way of conserving energy for vital functions like circulation, digestion, and organ maintenance. Social withdrawal is another crucial warning sign. If your loved one, who once enjoyed visits from friends and family, now prefers solitude or finds conversation exhausting, it could indicate their physical and mental reserves are diminishing. This isn't necessarily depression, although the two can overlap, but rather a natural part of the body's decline. The effort required to maintain conversations, process information, or even respond to simple questions may feel increasingly draining. You may also notice a change in emotional responsiveness. Someone who once laughed easily at jokes or took pleasure in small daily joys may now appear emotionally distant or unresponsive. This blunting of emotions is not uncommon as the body shifts into a state of conservation, prioritizing only the most necessary functions for survival. It's essential to approach these changes with empathy rather than pressure. Encouraging participation in modified, less demanding versions of their favorite activities can be helpful. For instance, If they once loved reading but now find it tiring, audiobooks might be a more manageable alternative. If social gatherings feel overwhelming, short one-on-one visits in a quiet setting may be more comfortable. Recognizing this withdrawal as a potential sign of the body's transition allows families to make the most of their time together. Instead of pushing for old routines, shifting the focus to comfort, companionship, and reminiscing about cherished memories can provide a sense of peace and fulfillment in their final months. Skin changes and increased fragility. Skin can be one of the earliest indicators that an elderly loved one is approaching their final year. While some changes are expected with aging, a sudden increase in skin fragility, excessive bruising, or discoloration could signal a deeper health decline. The body, as it starts prioritizing vital functions, gradually reduces blood flow to the skin. This results in thinner, more delicate skin that bruises easily and heals much slower than before. Even minor bumps that once barely left a mark can now result in deep, long-lasting bruises or open wounds that take weeks to mend. One of the most noticeable changes is a shift in skin color. If you observe that your loved one's skin appears pale, mottled, or even has a bluish or purplish tint, especially on the hands, feet, or knees, this is often due to poor circulation. The heart and other organs are not functioning as efficiently, leading to less oxygen being delivered to the extremities. This can make their hands and feet feel unnaturally cold, even when the rest of the body is warm. Some elderly individuals might also experience dry, flaky skin that becomes increasingly itchy and irritated, making them more uncomfortable. Another significant concern is delayed wound healing. A small cut or scrape that would have previously healed within days may now linger for weeks, sometimes even turning into a persistent wound. This is largely due to the immune system slowing down, making it harder for the body to repair tissue and fight off infections. In some cases, pressure ulcers, bed sores, may develop, particularly if the person is bedridden or sitting for long periods without movement. These sores can be painful and difficult to treat, making prevention crucial. Temperature regulation also becomes a major issue. Many elderly individuals in their final stage of life struggle to maintain body heat, often feeling cold despite warm surroundings. You may notice them constantly reaching for blankets, wearing extra layers, or complaining of a persistent chill. This is not just discomfort. It's another indication that the body is conserving energy for essential functions, such as keeping the heart and brain working, rather than maintaining skin temperature. Recognizing these changes early allows for better care and greater comfort. Regular moisturizing, gentle repositioning, and ensuring their environment is warm and soothing can make a significant difference in their well-being. Most importantly, understanding these signs helps you prepare emotionally and physically, ensuring that your loved one's final months are filled with dignity, warmth, and as much comfort as possible. Episodes of disorientation or momentary confusion. If your elderly loved one has moments where they suddenly seem lost, forget familiar names, or struggle to recall recent conversations, it may be more than just ordinary forgetfulness. These brief but noticeable lapses in clarity can be an early indicator that the body is struggling, particularly in maintaining consistent oxygen flow to the brain. Unlike dementia, which typically follows a progressive pattern, these moments of confusion often appear suddenly and unpredictably. You might notice that they ask the same question multiple times in a short span, have difficulty following a familiar route, or place objects in odd locations, like putting the TV remote in the fridge. Sometimes they may appear to zone out, staring blankly as if disconnected from their surroundings. While these episodes might last only a few moments, their frequency and intensity tend to increase over time. One major cause of such confusion is reduced blood circulation, which impacts brain function. As the heart weakens, it struggles to pump adequate oxygen and nutrients to the brain, leading to intermittent mental fog. Additionally, underlying infections such as urinary tract infections can cause sudden cognitive shifts in the elderly, even if they show no other symptoms. Dehydration is another common trigger, as older adults often drink less water without realizing the impact on their mental state. Another crucial factor is medication. Many seniors take multiple prescriptions, and drug interactions or incorrect dosages can contribute to periods of disorientation. If you notice a sudden change after a medication adjustment, Consult a doctor to see if an alternative is available. As these moments of disorientation become more frequent, they can also affect a person's sense of time and place. Your loved one may forget what day it is, believe they are in a different decade, or mistake a relative for someone from their past. They may also exhibit difficulty recognizing their surroundings, even in a familiar home. These incidents can be distressing, not only for the individual experiencing them, but also for family members witnessing the change. What can you do? First, stay patient and calm. Rushing or pressuring them can increase frustration and anxiety. Keep their environment structured. Label drawers, set reminders, and encourage hydration. Also, ensure they have a well-balanced diet to support brain function. Engage them in gentle mental stimulation, such as puzzles or familiar stories, to help maintain cognitive abilities. If these episodes become more frequent or severe, consider seeking medical advice to rule out underlying issues. Recognizing these small yet significant shifts allows you to provide better support, ensuring they remain as comfortable and connected as possible. 5. Difficulty swallowing or changes in eating habits. One of the most concerning yet often overlooked signs that an elderly loved one may be in their final year is a noticeable change in their eating habits. If they begin eating significantly less, chewing more slowly, or avoiding food altogether, it's rarely just a matter of losing interest in meals. Instead, it can indicate a decline in their body's ability to process food efficiently, often due to a condition called dysphagia, difficulty swallowing. Dysphagia occurs when the muscles responsible for swallowing weaken, making it harder for food to travel down the throat. You may notice that your loved one takes much longer to finish their meals or frequently coughs while eating. In some cases, they may even start avoiding certain foods that require more effort to chew and swallow, such as meats or crunchy vegetables. This difficulty isn't just frustrating, it can be dangerous. Swallowing impairment significantly increases the risk of choking or aspiration pneumonia, a life-threatening condition that occurs when food or liquid enters the lungs instead of the stomach, leading to infection. Beyond mechanical swallowing issues, their overall appetite may decline. The body, as it nears its final stages, often slows down digestion and reduces hunger signals. Meals that once brought joy may no longer seem appealing, and your loved one might start skipping meals entirely. This shift isn't necessarily a conscious decision. Rather, their metabolism is adjusting as the body begins conserving energy rather than processing food for long-term sustenance. Even if they still eat, they may prefer small portions of soft foods, avoiding heavier meals that feel too taxing to digest. Another crucial factor is dehydration. Elderly individuals who struggle to eat often reduce their fluid intake as well, leading to dry mouth, increased fatigue, and even confusion. Dehydration can exacerbate existing health conditions, making it even more important to encourage gentle hydration. If your loved one resists drinking plain water, offering broths, herbal teas, or electrolyte drinks can help maintain their fluid balance. Instead of insisting on full meals, a better approach is to focus on easy-to-eat, nutrient-dense foods. Soft foods like mashed potatoes, yogurt, pureed soups, and smoothies can provide essential nutrients without requiring excessive chewing or effort. In some cases, thickened liquids may be necessary to reduce choking risks. Every meal should prioritize comfort and ease, rather than adhering to past eating habits. Recognizing these changes early allows for timely interventions, such as consulting a healthcare professional about diet modifications or swallowing therapies. Most importantly, it provides an opportunity to adjust mealtime routines with care and patience, ensuring your loved one continues to feel nurtured, respected, and comforted in their final chapter of life. 6. Subtle but persistent breathing changes. Breathing is an automatic function we often take for granted, but in an aging loved one, subtle shifts in their breathing patterns can be an early warning that their body is struggling to keep up. If your elderly relative starts experiencing frequent shortness of breath, even during simple tasks like talking or sitting, it could indicate a decline in heart and lung efficiency. You may notice them pausing between breaths more often or exhaling with an unusual effort. These small but persistent changes should not be ignored. One of the most telling signs is an irregular breathing pattern, known as Cheney-Stokes breathing. This is when their breathing alternates between deep, rapid breaths and moments of no breathing at all. This cycle may happen during sleep or even when they're awake, signaling that their body is finding it harder to regulate oxygen intake. If you've ever noticed your loved one sighing deeply or suddenly gasping for air, it could be a sign that their respiratory muscles are weakening. Additionally, some elderly individuals develop noisy breathing, where their inhales or exhales sound strained, wheezy, or rattling. This can be due to fluid buildup in the lungs, reduced throat muscle control, or secretions that they are no longer able to clear effectively. If their voice becomes softer or they seem to cough frequently without relief, it could point to deeper respiratory concerns. Beyond the physical signs, changes in breathing can affect their energy levels and overall comfort. As oxygen supply diminishes, they may seem more fatigued, have trouble staying alert, or even become confused more often. This is because the brain and muscles are not receiving the oxygen they need to function optimally. Over time, they may also lose interest in eating, speaking, or engaging with others because even those simple actions feel exhausting. These breathing changes can progress gradually, making them easy to overlook, especially if they're mistaken for normal aging. But if you notice your loved one struggling to breathe more often, needing to sit upright to catch their breath, or showing signs of anxiety when breathing, it's crucial to seek medical advice. Proper support, whether through oxygen therapy, breathing exercises, or comfort care, can make a significant difference in their quality of life during this delicate stage. Recognizing these 6 silent signs can help you provide the love, care, and support your elderly loved one needs during their final chapter. Every moment is precious, and by paying attention to these subtle changes, you can make sure their journey is filled with dignity, comfort, and cherished memories. If you found this video helpful, be sure to like, comment, and subscribe so you never miss valuable insights on elder care and health. Remember, knowledge is the key to providing the best for our loved ones.